Okay, we're back with Bernice's case, and we're now using a hex driver, a 0.5 hex driver, and we're removing the IMZ screws one at a time, and we're going to compare the threads on these screws. Many labs will custom their own screws to be used when they're doing a combination case like this. So we just have to find out what the length of these. So this will be equivalent to tooth number 6 as I give this to my dental assistant. Okay, it's number 6 and number 5. Let's see, we're going to do number 4 next. So we'll do 4 and then we'll leave 5 for last. That's in the middle. So as we back out, 5 went out nice. So this is number 4 next. You okay? Are you alright? Yep. Okay. Okay. Hold on. I don't have a good grip on it. I got to bring it out. You know what, Jen? Let me get the middle one up and we'll just take them out together. Alright? Alrighty. Now some of those TIEs are going to pop out probably with this, so just be real super careful. Let me get in there before you pop it out. And I'll just hold for a second. No, I'm just going to hold it. Let me go. I'm going to slide in there now, coming off the scope. And I'm just going to pop everything out together like that. And we'll take a look at it. Just stay put. Don't put any water in there. We'll leave it alone. Okay, so here's what we have, the understructure, and what you can see on the understructure, there is some oxidation that can be cleaned up on both the distal sides. So this is number 4, 5, and 6 respectively. Here are the threads. So we're going to also check for length of threads. This is the one that was experiencing the exudate. Would be kind of nice if we could polish the underside and let the tissue side get that highly polished again for the patient. So we'll put that on our list of things we need to do. Alright, so this will go into a cleaner. Now we have the screws are in there in their position, so this is going to be number okay, this is 5. Okay, and okay, good. That's 4. All right. Here we are back in the mouth. And there are the old IMEs. Alright, and below them we have the TIEs. So we have to now, we're going to take one off at a time, clean it up, and then replace it. We have the parts, so but we want to identify first what we're dealing with, so let's do that. Okay, and we can do this without taking anything off, just gentle prodding here. And I'll take the microsuction. And we'll do a cotton roll change. That one filled up with a lot of water. There we go. Just touching base. Bernice, how you doing? Okay, good. Yeah, very easy to see everything. That old part's got to be changed out. They're all beat up. Okay, yep, that's a 1.0, but I'll need a periodontal probe to make sure. Oh, there's the fracture one in the middle. Let me get that one out before it floats away on us. Oh boy. Okie dokie. There it is. That's a horizontal. We'll get that out. So we're going to move right to this little part. Take a look at it first. So here's our part. And there is the 1 millimeter, but let's just double check it. We'll use the periodontal probe. Okay, and that is exactly 1 millimeter, so we do have the right part ordered. We'll change those out. We're going to separate this out in a little bit and get this middle portion. So where the fracture occurred was in the plastic IME, intramobile element. These are almost fused together. We're going to take time now. We'll use a scaler. I like to use a scaler, and we'll just slowly back that out gently. Sometimes it takes a little doing. Let's just see. We can start the process. Okay, microsuction. Yep. And back down the microscope. Okay. Sometimes those threads are so fused in there on the plastic side. You can see where there was an attempt to go down the middle to remove it in a prior attempt from another office. So we're just looking at that, and we're noticing also this one fractured as well. So cotton plier. And this identical situation occurred. Yep. 6 and number 5 respectively. They're identical. Okay, I'm going to come back again. We're going to try to remove these now, but we'll move back on the next segment. Dr. Gerard Cuomo with a IMZ case.